All right, Chapter 18, Blood, Part 2. So, leukemia. Leukemia is cancer of the red bone marrow, cancer of those the stem cells that produce all of our blood cells. And what happens is there's an abnormal amount of production in non-functional white blood cells. So that we go from having nice healthy blood with lots of red blood cells and a few white blood cells and platelets to abnormal blood where there's tons of white blood cells that do not function, non-functional white blood cells, and a decrease in all the other kinds of cells because the abnormal production is interfering with regular blood cell production, leading to all kinds of symptoms, a compromised immune system, anemia, so forth. So treatments. The one treatment out there is to replace the red bone marrow from the person with leukemia with that from someone else. And basically, the way it works is the person with leukemia takes chemotherapy, anti-cancer drugs, get radiation, basically to kill off their own red bone marrow, to get rid of their red bone marrow that's cancerous. And then a healthy donor who is a good match, an extremely good match with the recipient, then donates some red bone marrow that then gets injected into the patient's bone, one or more bones, so the patient can now make new blood cells that are healthy and cancer-free. Again, there must be an extremely good match between the recipient and the donor. Otherwise, the new blood cells being produced will be attacking the patient's body, and that would be a very bad reaction. All right, platelets. Platelets, the last of the different cell types. Platelets are actually little bits of cells. This starts off with this really big megakaryoblast, and it stays in the red bone marrow, and then it just blebs off little bits that whenever they are needed, and those are what we call the platelets. They are not real cells, they are formed elements. And they tend to be much smaller than erythrocytes by quite a lot and kind of discus shaped. Their function is to release chemicals to promote blood clotting. So basically, they help release the chemicals that will activate the protein fibrinogen. Remember, fibrinogen is always found in the plasma, and when it's activated, it becomes fibrin. And the protein fibrin then forms this big mesh that catches blood cells, lots of red blood cells, causing agglutination, causing a big clot to form to try and prevent the loss of blood. Because again, you lose your blood, you will die. Blood clots can get extremely large. If you go to YouTube, you might be able to find some videos where people pull out these huge, nasty blood clots that formed in their nasal cavity from a nosebleed, so it can get quite big. The other function that platelets have that's related to preventing blood loss is forming platelet plugs. So here, the platelets will collect at the ends of a damaged blood vessel and block it off so that blood does not flow through that damaged blood vessel anymore. This only works for small blood vessels. So it only works for small blood vessels, not the big ones. So platelet plug formation, you get your damage, blood is now being released. Platelets will respond to the chemicals released by the damaged cells of the blood vessel. They'll accumulate at the ends and form a plug that blocks the loss of blood. And again, only good for small vessels. And stopping bleeding is called hemostasis. So hemostasis is a way to prevent the loss of blood. Again, blood agglutination, all these little white lines here, that's fibrin. Fibrins form this big mesh that's catching the red blood cells and other blood cells, forming a big blood clot, a big agglutination. And that then stops the loss of blood. And that is it for Chapter 18.